Alright, in this video, we are going to discuss and review a movement and exercise sequence that we can use when dealing with acute neck pain. But to understand why we're using these exercises and why we need to prescribe them in this specific way, we're going to need to start with some basic concepts and understand some key points we're trying to accomplish here. So let's start with some very basic background information. Now remember, and as I've discussed in other articles and videos, when dealing with acute muscle and joint pain, movement, especially movement in the form of exercise, is going to be a powerful stimulus in the initial stages of care. Remember, it's through biological processes like through mechanotransduction that movement and exercise allows us to essentially communicate with the body. Now, from a physiological perspective, movement can be a powerful tool to reduce swelling and inflammation, control pain, and even guide tissue healing. But movement can also have powerful cognitive and psychological effects as well. This is really where we can help patients to understand the meaning of pain, to understand how hurt doesn't always necessarily mean it's harmful, and how we sometimes need to work into the symptoms as part of the recovery and rehabilitation process. But beyond these basic psychological and cognitive behavioral principles, we also need to think of this from a functional perspective. So remember, it's not just pain that matters. We're also needing to keep the big picture in mind. What we're really trying to do with these patients is restore their neck to proper health and full functional capacity. So what we're really trying to do with our initial exercise treatment and our exercise prescription is we want our neck pain patients to develop and regain tolerance to basic neck movements. Movement is important, but we need to use and apply these principles and use movement and exercise in the right way. We don't just tell our patients to keep moving and ignore their pain and symptoms. There's a lot more to it than that. For movement and exercise to be effective with acute neck pain, there are going to be a few key principles we need to consider. Now, first, these movements and exercises must be safe. And we need to be capable of modifying the stimulus intensity with each movement. Yes, of course, we're trying to create and direct movement at the neck as a critical part of our treatment, but we also need to respect the patient's symptoms and any potential tissue injury or pathology. We need to control symptoms and guide healing, but we also need to minimize the chances of further injury or a potential flare-up. So to do this, we are going to base our movement and our exercise prescription on what I refer to as head slides. Here we're going to use motion of the head to create and access motion at the neck. This is really similar to how we would use pelvic tilt exercises when we're dealing with back pain and dysfunction, but here we're applying these principles to the other end of the spine. Now, another key thing to keep in mind here is that these exercises can and will be performed in a supine, non-weight-bearing posture, at least initially. This really minimizes the compressive forces on the neck itself and on the spine itself, making the load safer in these initial stages of care. Now, lastly, note that these are not static stretches. They're active motions that utilize the deep muscles that surround the neck to drive the motion itself. Again, this will not only help target motion at the individual joint segments, but these contract-relax cycles can also be very helpful in pushing and squeezing any inflammation from that area through those contract-relax cycles. Furthermore, being active, we can also control the force and the intensity of the motion itself and the range that's used much more than we could with a passive stretch. So what I'm going to do for the remainder of this video is I'm going to go over the exercises themselves. Once I've gone through all of the exercises, I'll wrap up the video by talking about key programming and progression criteria. This is really where we're going to talk about things like what's okay and what's not okay as far as patient symptoms, how many sets and reps and how often they should be performing the exercises. And also we're going to talk about how we know when we're ready to progress to the next phase of our exercise prescription with these neck pain patients. And just as one last FYI, if you are a My Rehab Connection subscriber and you use our exercise prescription software, you can find this movement sequence in the exercise group section under the title Basic Neck Mobility Sequence, Pain Tolerance Focus. All right, let's take a look at the exercises themselves. All right, so the first exercise we're going to look at, and this is really my go-to exercise that I'm going to prescribe first in almost every single case of acute neck pain patients, is going to be what I call our supine head slides. This is really going to target flexion extension of the neck itself. Now, keep in mind what we're going to do is we're going to go on our back. Knees can be straight or knees can be up. It really doesn't matter. It's about patient preference. And we need our head to be able to slide. Now, in my case here, I'm just going to use my little slider disc just so we kind of reduce the friction between the head and the floor. But in most patients, you're actually going to need to put a book or prop something up under the head. Especially with patients with neck pain, it's very common to have an anterior head carriage, and we want to make sure we support the head. If we do have one of these large anterior head carriages and we don't use a book for support, what's often going to happen is the head has to extend a fair bit backwards in order to meet the floor, and it's going to set the exercise up from a poor position to start. All right, so with our head supported, we're going to slide the back of the head up and down. So if I rotate my head such that my chin goes up towards the ceiling, the back of my head is essentially getting closer to my lower neck and lower shoulders. This is going to create more extension through the neck, and it's going to kind of create more of an arch, as if we're arching the neck slightly off the floor. We're going to hold this for just a moment, and then we're going to rotate in the opposite direction. I'm going to pull my chin down in towards my neck. As I do this, the back of my head is going to slide up the book. The back of my head is getting farther away from my shoulders. This is going to create flexion or a lessening of the curve of the cervical spine. It's essentially bending the spine down towards the floor. This is going to open the joints on the back of the neck, and it's going to create a stretch through the posterior spine, through the joint capsules, through the muscles, etc. And what I'm going to do is perform 10 slow oscillations back and forth. I'm going to go slow. I'm going to keep that head sliding. I don't want to lift. I want to keep the forces low. And I'm just going to create this sliding motion. Again, I'm going to go slow. And I want to be deliberate. I want to create every last little degree of motion that I can, especially going into this flexion position. But I'm going to limit to symptom tolerance. That means a little bit of tightness or achiness is okay, but it should not be painful to the patient. It should be very tolerable. So again, 10 slow repetitions back and forth. All right, so the next exercise we're going to perform, again, is going to utilize this head sliding motion, and we're going to, again, do it from a supine position, but here we're going to target rotation of the neck. So again, we're lying supine. I want something under my head so it can slide. This can be a book if needed, if the patient has an anterior head carriage, as we previously discussed. Now from here, I'm going to keep my head sliding, and I'm simply going to turn my head to the right as far as I can. I'm going to hold just for a moment. I'm going to slide my head. I'm going to turn all the way to the left as far as I can. And I'm just going to perform 10 slow oscillations, 10 slow movements back and forth. Now remember, what we're trying to do here is to create motion, but we're not forcing into pain. So we're going to move as far as we can, but within tolerance. We're not forcing the motion. We're just trying to create some contract, relax cycles and create some rotational motion through the cervical joints. Now, one other thing to keep in mind here is that most of the muscles that are going to limit rotation are going to live on the posterior half of the neck. And what that means is when you go to turn, as those muscles tighten up, the neck is often going to want to extend in order to create farther motion. And we want to minimize this. We want to keep the neck a little bit more lined up. So what we're going to do is we're going to perform an ever so slight little chin tuck, not an aggressive or far chin tuck like we did in our head slides that targeted flexion extension, but just a slight little chin tuck. And this just helps to keep the cervical spine in line It helps to create more of a pure rotational motion. So as I turn, I'm just keeping my chin slightly tucked down. As I keep it tucked down, it prevents the neck from wanting to extend up during the motion. Now, the other thing to keep in mind here is as I'm moving, I'm trying to keep my upper back and my shoulders relaxed. I want to try to isolate the motion to the neck itself. I'm trying to kind of reduce the tension through the rest of my body. The next exercise we're going to talk about is going to be similar to our original exercise where we're using head slides to create flexion and extension through the neck. But now we're going to perform a similar thing, but we're going to use a roller. Now the idea here is that, if we recall, the neck is not a joint, it's a series of joints. And so we need to create motion through all of the joints. Now, when we're doing this with our head a little bit more flat, either just on the floor itself or on a book, it does help to target more the middle to upper cervical joints, but we also need to do something to make sure we're accessing the middle to lower joints. And this is where the roller comes in. So essentially, I'm in a similar position, but instead of my head being on the floor or on a thin book, I'm going to put it on a roller. Now the idea here is, now that I'm starting in a little bit of a higher up position and I create this rolling motion, my chin is going to end up being much farther down towards the base of my neck, towards the kind of top part of my sternum. I'm trying to create this rolling motion as if I'm tucking my head and tucking my chin down in towards the neck. Again, we should still feel a stretch in the back of the neck, but now we're going to feel it a little bit lower down into the lower portion of the neck and even into that upper cervical spine a little bit. Again, from this position, I can reverse the motion, lifting my chin up, creating extension through the neck, rotating back down, and I'm trying to really pull that chin down into the top part of my sternum. Again, like in our previous exercise, this is 10 slow, deliberate repetitions back and forth. I'm going to move as far as I can, but again, within tolerance. We're not forcing the motion. Also, I'm going to try to keep shoulders and upper back relaxed. Motion is going to be isolated to the neck itself. Now, just as a side note, you do need the roller in order to do this properly. If we simply use a thicker book or something more static or stationary, as we rotate, the back of the the back of the neck tends to just jam into the object. When we're rolling, the roller is nice because it just kind of gets out of the way a little bit to create some space in order to drop that neck down and drop the chin down. We're trying to create that bowing effect, like we're trying to bow the neck down towards the floor in this flexed position. All right, now the final exercise we're going to take a look at, again, it's going to utilize the roller, but now we're targeting rotation. Again, the idea with the roller is this is going to focus a little bit more on the middle to lower joints of the cervical spine. Now, again, starting on our back, roller is under the head. I'm going to, just like I did with my rotational exercises with my head being flatter or on the ground or book, I'm going to create just an ever so slight little chin tuck. Again, not aggressive, but just to kind of start to engage those muscles on the front and prevent the head from extending while I'm doing my rotations. And here, again, I can hold on to the roller if I need to, especially if it's a short one like I'm using here, just to kind of keep it in place. And I'm just going to rotate to one side, hold for a moment, rotate to the opposite side. Again, I'm trying to isolate the motion to the neck itself. I'm trying to move as far as I can, but again, keeping it within comfort. Some achy, pulley symptoms are acceptable, but we're not trying to force into pain. 10 slow repetitions back and forth. All right, now that we've gone over the program itself, let's go over some key programming and progression criteria. Now, first, as I briefly mentioned when reviewing the exercises themselves, the key with these movements is to move to symptom tolerance. In other words, we want to move as far as possible into each direction, but we do not want to force the neck into painful positions. This is really more about trying to restore basic movement tolerance, but we don't want to think of this as a no pain, no gain scenario. Now, also keep in mind that the motions don't need to be symmetrical. What that means is with our exercises, especially with our rotational exercises, the motions may need to initially be biased towards either the right or left side. So like I said, we don't need to worry too much about symmetry at this point. We simply want as much motion in each direction as the neck will allow in these initial stages of care. Now, we also need to be clear about how we explain these exercises to patients. Remember, with a really painful or acute neck, some patients are going to be very hesitant and maybe even fearful of moving too much, especially if some of these movements create or reproduce the symptoms that they're experiencing. Now, here it is very helpful to point out that these are all gentle, non-weight-bearing exercises. And what this means is that any symptoms that they experience, at least if we're keeping the movements to symptom tolerance, as we've been discussing, are going to be the result more of tissue inflammation or hypersensitivity as opposed to further damage and injury. Now, as far as programming, the typical prescription of these exercises is we're going to perform each of these movements for 10 slow, deliberate repetitions. And that's really a big key here. We want to go slow. We want to feel the effect occurring at the neck. And we want to be deliberate with these. That means when we're doing them, we're paying attention to motion at the neck. We are present in the moment with the exercises. And we're essentially going to repeat this every few hours. The idea here is we're trying to create a light, easy, controllable stimulus, but we're trying to provide this stimulus on a very regular basis throughout the day. Finally, in terms of progression criteria, remember the key goal with these exercises is we're trying to regain tolerance to basic movements. So what we're really looking for here is the point at which pain and symptoms don't limit the patient moving with these exercises. Now, to be clear, that doesn't necessarily mean it has to be a pain-free neck in general. It certainly won't be in most cases. And it also doesn't mean that we can't have any symptom whatsoever. If we have a little bit of kind of tender, achy symptoms, but this symptom does not limit the range and the patient can get to the ends of each position or each motion, then we're generally ready to prescribe the next set of exercises. Now, this will typically be when dealing with neck pain patients. We're going to shift our focus to more of an acute tolerance focus to more one of building control and mobility of the cervical spine itself.